Ever wondered how a delightful meal could turn into a health disaster? Take the December 2023 E. coli outbreak reported by newspapers to be associated with artisan cheese sold in Waitrose, which has been allegedly found in Christmas hampers. This outbreak resulted in the unfortunate demise of one person and sent 11 others to the hospital. Today, we're delving into the treacherous realm of E. coli food poisoning. E. coli, or Escherichia coli, is a type of bacteria that typically resides in our intestines and is often harmless. Nonetheless, certain strains can cause intense food poisoning. So where exactly does this harmful E. coli originate from? The primary sources in the UK include contaminated water, undercooked ground beef, raw milk, and unwashed vegetables. According to the British Journal of Nutrition, BJN, these sources are linked to several outbreaks in the country. When food and water aren't suitably handled or cooked, they can become carriers for these bacteria. Unpasteurized milk presents another potential source. The pasteurization process aims to kill bacteria, but if milk is consumed raw, it may harbor E. coli among other pathogens. Lastly, contaminated meat, particularly undercooked or raw ground meat, is a frequent source of E. coli. The bacteria inhabit the intestines of animals, and during the meat processing, E. coli can up on the final product. Recognizing the sources of E. coli will aid us in dodging this unpleasant predicament. So, you've been unfortunate enough to contract E. coli. What now? Let's talk about treatment. If you suspect E. coli infection, it's crucial to seek medical attention promptly. According to the British Medical Journal, BMJ, treatment typically involves supportive care, such as fluid replacement and electrolyte balance restoration. In severe cases, antibiotics may be prescribed, but it's important to note that their use is controversial and should be under medical supervision to avoid complication. For babies, breast or bottle feeding should continue, with small, frequent feeds if they're being sick. Babies on formula or solid foods can have small sips of water between feeds. Rest is another important part of recovery. It allows the body to focus its energy on fighting off the infection, so take it easy and avoid strenuous activities. Eating when you're able to is also recommended. However, it's best to avoid fatty or spicy foods as they can exacerbate symptoms. Medical treatments such as antibiotics may be necessary in some cases. However, they're not routinely used to treat E. coli infections as they can sometimes lead to complications. Therefore, it's important to seek medical advice if symptoms persist or worsen. Over-the-counter treatments like paracetamol can be taken to ease discomfort, but do check the leaflet before giving it to a child. Conversely, fruit juice and fizzy drinks should be avoided as they can worsen diarrhea. And crucially, good hygiene practices should be followed to prevent spreading the infection to others. Remember, it's advised to stay off work or school until you're not experiencing sickness or diarrhea for at least 2 days. If you have a high temperature or aren't feeling well enough for normal activities, it's recommended to stay at home and avoid contact with others. It's not just about a bad stomach. E. coli can have more serious effects. Let's delve deeper. When E. coli bacteria invade our bodies, they do more than just upset our stomachs. The initial symptoms usually include severe diarrhea, which can be bloody, accompanied by intense abdominal cramping. As your body fights the infection, you might also experience fatigue and a general feeling of being unwell. However, these symptoms are just the tip of the iceberg. The real danger lies in the potential long-term effects of E. coli food poisoning. In severe cases, the infection can lead to a serious complication known as hemolytic uremic syndrome, or HUS. This condition is characterized by the destruction of red blood cells, which can lead to kidney failure. HUS is most common in children under 5 and older adults. Its symptoms include decreased frequency of urination, extreme fatigue, and loss of pink color in cheeks and inside the lower eyelids. If not treated promptly, it can lead to serious kidney damage or even death. Even if you recover from the acute symptoms of E. coli food poisoning, you might still experience post-infection complications. These include irritable bowel syndrome, kidney problems, and high blood pressure. Some people have also reported experiencing neurological effects, such as seizures or strokes. In summary, E. coli food poisoning is not a condition to be taken lightly. It's more than just a bad bout of diarrhea and stomach cramps. The effects can be long-lasting and severe, impacting your health for years to come. E. coli is more than a simple stomach bug. The effects can be long-lasting and severe. In some cases, E. coli can pose a severe risk to life. Let's discuss these life-threatening complications. The most alarming complication of an E. coli infection is hemolytic uremic syndrome, or HUS. This is a condition that affects the blood and blood vessels, resulting in the destruction of blood platelets, a decrease in red blood cells, and kidney failure. It's a serious condition which can be fatal if not treated promptly and effectively. Another rare but life-threatening complication is thrombotic thrombocytopenic purpura, often shortened to TTP. This condition causes the formation of small blood clots throughout the body. These clots can block the flow of blood to vital organs, causing them to malfunction or even fail. Additionally, severe dehydration may result from the diarrhea and vomiting associated with E. coli food poisoning. If not addressed, dehydration can lead to a dangerous drop in blood pressure, seizures, and even death. While these complications are rare, it's important to be aware of the risks. Now that we understand E. coli, how can we prevent it? As we journey into the realm of prevention, it becomes clear that knowledge is the greatest weapon against E. coli food poisoning. One of the most effective methods is proper food handling and cooking. Raw foods, particularly meat, are often carriers of E. coli. Therefore, cooking food at the right temperature is crucial. For instance, ground meat should be cooked to at least 70 degrees Celsius. But how about fruits and vegetables? They too can harbor E. coli. Washing them thoroughly under running water and peeling where possible can significantly reduce the risk. When it comes to dairy products and juices, always opt for pasteurized versions. Unpasteurized products can be a breeding ground for E. coli and other bacteria. Next, let's talk about personal hygiene. The importance of washing hands cannot be overstated. Make it a habit to wash your hands before and after handling food, after going to the washroom, changing diapers, or handling animals. It's a simple yet effective way to keep E. coli at bay. While we're on the topic of hygiene, let's not forget about kitchen cleanliness. Regularly clean and sanitize cutting boards, countertops, and utensils. It's also essential to keep raw and ready-to-eat foods separate to prevent cross-contamination. Avoiding risky foods and water sources is another crucial prevention strategy. Be wary of undercooked meats, raw shellfish, and raw eggs. When traveling, especially to areas with questionable water quality, stick to bottled or treated water. And remember, while E. coli food poisoning is more common in certain places and at certain times of the year, it can happen anywhere and anytime. So it's important to always stay vigilant and practice these prevention strategies. With these prevention strategies, you can enjoy your meals without the worry of E. coli food poisoning. Let's quickly revisit what we've learned today. We've delved into the world of E. coli food poisoning, uncovering its sources such as contaminated food and water. We've learned about effective treatments like staying hydrated and avoiding certain foods. We've also unpacked the effects it can have on our bodies and the life-threatening complications it could lead to if not properly treated. Lastly, we've discussed preventative measures to keep this notorious bacteria at bay. Stay safe, stay informed, and remember, prevention is always better than cure. Thank you for joining us on this channel. If you found this information valuable, don't forget to like, share, and subscribe. Stay healthy, everyone.